Good day, Nicole. Hope all is well for you and your wonderful family. I am here to present my portfolio. As I begin, nursing professionalism in contemporary practice by exploring the role of the nurse in applying college nurses of Ontario competency standard practice and guidelines to safe and ethical care. Professional and competency in nursing are essential in providing healthcare needs for patients. These are there are set codes of conduct that every nurse should follow to attain and maintain competency when dealing with both patients and colleagues, according to Catalano in 2018. Um, According to the College of Nurses of Ontario, codes are six in number. Nurses should respect patients' dignity and treat them individually, sensitivity, and respect about patients' health, regardless of their religions and beliefs, should be non-judgmental and collaborative and begin on the conflicting beliefs. The second code dictates that nurses should work together to promote patients' well-being by timely care, addressing gaps in care, and the third code is building and maintaining patients' trust by providing safe and professional care, maintaining competency, and doing the research before taking action on patients. The fourth code ensures respectful teamwork by proper communication with colleagues and collaboration to maintain trust and respect. The other code is to ensure integrity to maintain patients' trust by maintaining privacy and confidentiality in patients' health record and keeping it professional with all patients maintain boundaries with patients and accepting the gifts. The last code is to maintain public confidence in their profession by taking accountability for one's action and respecting patients' progress. All this aimed at improving patients' well-being. And the second question is professional relationship in the nurse's role when providing safe and ethical care to vulnerable patients. Nurse step up as leaders in response to change in healthcare for vulnerable patients. Nurses have a role in bringing their stories and know how affected person care, high quality safety, cost containment, and well-being as members of forums, elected officials, and nonprofit directors. There are their impact is tremendous as they balance vital questioning talents, monetary understanding, and compassion to steer executive decision making. The nurse also helps patients in understand their desire, network with different community sources, match wishes to services, execute secure transitions, and determine published discharge steps for care. Patient communication includes nurses introducing themselves and informing patients of the role in patient care after going through patients' records. To go along effectively, one has to create a sense of safety for the patients to communicate and freely open up about their underlying condition. Maintain ethical sharing of information among nurses to ensure patients' health information confidentiality. Proper colleague communication is also important to patients' welfare and colleague interrelations. Advocacy comes hand in hand when promoting well-being patients, the quality among helping the patients make proper health decisions. Um, my thoughts regarding the professional role of the nurse leader within Canadian healthcare system. The College of Ontario, the College of Nurses of Ontario mainly focuses on four main factors: expertise, competency, assurance, entry to practice and enforcement. Combining with the six codes of conduct, CNO mainly focuses on patients' welfare. As future nurse here in Canada, I truly believe in my best of capability I can help and how to improve nurse services and interaction among them, which improves the patient services. Professionalism of nurses is one of the major emphasis of patients and colleagues. Moreover, nurses are also to be accountable for their actions. The level of nursing services will be shaped, and therefore new nurses are and learners to gain all the required skills in the profession. Canadian healthcare system has clear guidelines on how should conduct their services in the presence and absence of doctors. What registered nurse are and an RN and RPN should not do. Clarification of what they can or cannot do are given with stipulated steps to performing certain acts. There are also stating of orders type, where and how to get orders. Delegation is also explained how, when, who, from, and whom you delegate a specific act to. This only applies for controlled acts. There is also a statement of instances when you can initiate controlled acts even without an order. This comes with the responsibility of initiated. If initiated, controlled acts differ with organization. Nurse accountability is still one of the major emphasis in keeping it professional and how they handle patients and their colleagues. Furthermore, nurse leaders and managers are responsible for supervising and maintaining a healthy working environment. I feel this form of leadership helps in improving nursing services. This is attained by teamwork created by CNO Code of Conduct. Our role as nursing leaders and bosses are distinct inside essence of the obligation and concern. As future nurse here in Canada, I can be a role model as nurse leader and respect and maintain professionalism at work. I believe a great facet of a leader is by building bonds based on trust and respect. Um, Thank you, Ms. Nicole, and God bless.